Hi guys, and welcome to my channel. This is Underneath Your Skin, and you're here today with Nicolin, and I have a special guest here with me, Dr. Benny. So Underneath Our Skin, hello. So Underneath Our Skin is a channel that we talk about the things that we go through in silence, some of the things that we are not so proud of sharing or feel comfortable disclosing. But today I have a guest here with me who I'm really, really excited to, introduce to you guys and for you guys to learn more about. But I wanted to share with you how I met Dr. Benny. So we literally met each other a few weeks ago.
Yeah.
And Dr. Benny's a dentist. And so I booked an appointment at Dr. Glen's Happy Teeth. That's the dentist close to home. And they're located in Long Beach, Long Island. And I booked an appointment simply just to go get a regular dental checkup, a dental cleaning. But little did I know, there was a lot more in store for me that I was not expecting. So I had to see Dr. Benny, and I would tell you my experience was wonderful. He's amazing. So if anyone want to go check out Dr. Glen's Happy Teeth, the staff there and both dentists are absolutely phenomenal. So thank you so much. They do also have a pediatric dentist that my daughters go to. That's Dr. Glen. Shout out to Dr. Glen. He's also amazing. And so I wanted to share with you that story, and we can talk a little bit more, Dr. Benny, about my visit to you. But I also want you to introduce yourself and tell us a little bit about who you are.
Oh, of course. Well, thank you so much for having me here, Nicklin.
No problem. Thank you for being here.
Well, I'm a general dentist, and I had the pleasure of meeting you a few weeks ago as well. And I've been practicing privately since, for 4 or 5 years now. I finished dental school in 2014 at Buffalo, did my 2-year residency, and was a chief for a year near the end. And then started to go in private practice after in 2016. Mm-hmm. So I've been with Dr. Glen for a little over 3 years now. And I also teach at the same residency program that I finished at.
Oh, nice. Wow.
And, thank you. Yeah. At NYU Winthrop in Garden City. Well, Mineola, I believe now. Yes, Mineola.
Yes.
Mm-hmm. So I also teach there, and I'm very big on prevention. I tell my patients all the time that we could sit here all day and drill your teeth for many years to come, and it'll never end if you don't change your habits. Yeah. So at this point, my job is just to make sure I'm educating, keeping my patients informed on the new techniques, products, and just to make sure that your oral health stays healthy for the rest of your life. And that's my goal, is to intervene and to break the cycle of this nonstop dental work, right?
Yes. And that is exactly what we're going to be talking about today. Healthy dental hygiene and how to keep our teeth, our gums, our entire mouth healthy and clean, right? So I would say to you that I guess based on what was going on, I wasn't doing everything I was supposed to do, right?
Yeah, we need to give you a slap on the hand a little bit there.
Yes, I was not doing everything I was supposed to do. So sorry, I had to, basically, I needed a deep cleaning, and I did not know that. But the honest truth is, Dr. Benny, is that I hadn't seen the dentist in a while. Like the last time I saw a dentist was in 2018, but I can't recall if I had a deep cleaning or just a regular cleaning. So that was one thing that showed that I'm not doing my regular checkups, right?
Right.
And which I need to do. So I wanted to talk a little bit more some of the things that we need to do in order to maintain proper, healthy dental hygiene.
Of course. So for the most part, most people qualify for just a regular cleaning. In and out, dental office, 15, 20 minutes, sometimes 30 minutes. If it's really clean, you guys are out pretty quick. And it's pretty painless too. But then there are people who don't keep the routine going, the flossing, the brushing. And next thing you know, the bacteria and the tartar are starting to build very close to the bone and in the gums. And that's what makes you end up having to do the deep cleaning. And unfortunately, a lot of people do fall into that category because of the lack of flossing. And, dentists are just not pushy enough about, you have to floss. So on average, most people should be seeing their dentist once to twice a year. So every 6 months is your normal. And the dentist would be able to take some x-rays, tell you if things are looking okay, and also examine your bone and your gums at that point. And I think the big misconception with people coming into the dentist is they're thinking about cavities all the time, not thinking about that you're trying to keep three things healthy, which is your teeth, your gums, and your bone.
Yeah.
Because you need the foundation to also be healthy in order for you to have healthy teeth.
Yes.
There's no point of, I think I told this to you too when you were in the chair. It was like, what's the point of having such a beautiful smile and pearly whites if your bone and your foundation is going, right? Like, and you're going to lose them.
You know, the thing about that is I never looked at it like that, because even when you said the teeth has bones.
Yeah.
Like, I was thinking, no, they don't, you know? And it's when you took the x-ray and you showed me, I was like, what? Because I think you mentioned that we're not as educated on dental health as we are on other areas of our bodies. And I think maybe that part, you know, as you're spreading awareness, we need to be more knowledgeable. And I think that's probably why some people kind of push it in the back burner and not really treat it as serious as, let's say, something like cancer or diabetes or something like that, you know? Right. So go ahead.
Oh, yes. I'm sorry. I was just like going on with your energy there. But yes, in that sense, the thing is, like, there's a lot of, you know, when I didn't went to dental school, I also didn't learn about certain things. Like, I was like, oh, like I had certain things with my mouth where I didn't know that they weren't normal until dental school came along either, right? So education is a big part. And you know, I tell patients, that's why the number one thing that when everyone's coming into my office the first time is to make sure I inform you guys of everything. And everyone's really unique and different. You know, what works for you might not work for someone else.
Absolutely.
At the point, it's my role to make sure that, you know, I look at what's going on and suggest things that may improve your situation. Let you try them. And most of the time, a lot of patients come back with big improvements. And that's what we're usually striving for. And then once they're back with big improvements, it's a very happy feeling because you actually made a difference at that point. Yeah, so it's really good to see that. But the thing is, we have to make sure we educate people on proper techniques with flossing and brushing. I think that's the number one thing that I'm noticing is that a lot of people are brushing wrong, they're flossing wrong, and they get frustrated because they're not getting results.
Yes.
They're doing it wrong and they're saying nothing's happening and their cleanings are still painful. They're still getting many treatments every time they go in. I think that's another big thing people are scared of. Every time they see a dentist, they're afraid to get the bad news, right? Yeah. I was one of them too.
Yeah.
But like I said,
go ahead.
It wasn't until I finally met a dentist when I was 15 that taught me the proper hygiene technique. And that's when I finally stopped getting cavities.
Oh, did he inspire you? He or she inspire you to become a dentist?
They didn't inspire me to be a dentist. You know what? They didn't inspire me to be a dentist. But I still appreciate what they did for me, which was educating me on proper hygiene. Yeah. And if I think about it, if I never encountered them at the age of 15, maybe my teeth wouldn't be still here at this day, right? Maybe it'd be really rotted out. Because I did have a problem where I was getting cavities every year or two.
Yes.
And at that point, it's like, what was causing it? And it was just proper knowledge of how to brush and floss.
Yes.
But I will never forget them because to this day, I am living proof that if you do for flossing and brushing, it works. And that's when I'm just trying to pass on that knowledge to my patients and make a little small preventive impact in this community here.
Yes. And I can say you're doing an amazing job because, like, honestly, if you weren't, you would not see me again, right? Because it's like, yes, you want your teeth to be clean, but how providers build long relationship with their customers or clients or whomever, it's how they're treated. So if I'm getting good service, if I feel like I'm getting, and it's beyond good service as well, because you are also educating, you taught me a lot. And I remember you were saying that my teeth, they're pretty close together. So I explained to you that flossing was a little challenging because it was hard sometimes to get in some of between some of my teeth. And then one of the main things you mentioned too was the back. Listen, it is not easy to get back there. It is so hard. So sometimes I would probably start right here, but there's more back there. And I was like, oh, that'll be fine, you know. Yeah. But I realized when you were doing my cleaning, that's where you spent most of your time. The back was where you spent most of your time. So it's like, it goes to show that if you're not taking care of it, then it definitely is going to require, you know,
Yeah.
deeper.
So it's good that you brought that up, because, and since we brought that part up, I can show you, like, there are problem spots I want people to focus on.
Okay.
And you're right. Like, there's some excuses that patients give us, or reasons why they don't floss in the back. It's hard. You know, it doesn't bother me. There's no pain. Why do I have to? And it's one of those things where I tell everybody that flossing is to keep your bone healthy. And losing bone isn't something that just happens.
To keep your bone healthy. I didn't hear you clearly, so.
Yes, to keep the bone healthy. And flossing is what's going to keep that healthy. You know, when you don't floss, about 35 to 30-something% of your mouth is still dirty.
Wow.
But at that point, those are dirty parts that happens to be in between. And but I do want to talk about some of the areas that you really have to focus on. Like,
nice, you got the teeth.
This little model we got going on here.
Yes.
A lot of people build tartar on your bottom fronts. All along the bottom front of our molars, right? Sometimes you'll see that those white, big, chunky stuff, and you can't brush it off, but you know it shouldn't be on your teeth. That's tartar, and that's something that builds up when you don't brush enough. It takes about 24 hours for plaque to start transforming to tartar, which is a cement hard stuff.
24 hours for plaque to start transferring into tartar.
Yes, and we're talking about little pieces, microscopically, it's little by little, but they're like building blocks. Eventually, after a few months, they become big, right? So if we got Google now, so you can always type Google in dental tartar, and you'll see it.
Wow.
So this is a common place where you're gonna get tartar, just because you have salivary glands down here.
Okay.
Gives off the minerals for the bacteria to build it up. But if you want to minimize it, flossing and brushing with the tip of your toothbrush. Okay. You're gonna want to brush with the tips of it.
Okay.
To really
Can you hold it so we can see the back of the teeth? Yeah.
Yes. Let me see if I can.
He's losing a teeth. Yes. Yeah. Perfect. That's better.
Like that. And you want to just use the tip of your toothbrush to kind of just get and work your way through, instead of using it the long way, which people cheat.
Yes.
Like an easy way of getting a cop out, but it's not really doing a good job, especially if you're crowding or things are rotated or your teeth aren't completely straight. You really want to work into the nooks and crannies of those little areas. You want to get it at all angles, right?
Yes.
And that's the number one thing. People are also getting a lot of buildup tartar around the back molar areas.
The areas that I can't get to.
Yeah. So usually these big guys here is where there's another gland that comes out here.
Okay.
And for those areas, people want to make sure they're brushing up there enough. The number one thing that people always mess up on the brushing is the angles of the brush.
Okay.
Instead of, let me see, hold up. Instead of brushing at a 45-degree angle, you're coming straight on. And you're missing the gum line when that happens. So we need patients to, if you really want to take care of your gums really well and brush well, after your normal routine of the up and down, left and right, circles, you want to angle it at a 45-degree angle too, and just brush upwards.
About at the top, yes.
And for the bottom, you're going to be angling downwards.
Yes.
Got it?
Yes.
So usually implementing that technique, that brushing technique, takes care of all the brushing issues.
Okay.
All right. And most patients would be very happy with that. But the flossing is another thing that people are always getting wrong. And that's another thing that I want to make sure people realize. A lot of patients tend to floss in a way where I have to use a mask loop because, you know, the thread is too thin. The regular floss, but hopefully this is beefy enough for people to see.
Yeah.
A lot of people tend to floss. They pop in the floss and just pull it out real quick. And then they go on to the next one like that.
Yes. Yes.
That's not flossing either. You are removing any like chicken or lettuce or spinach between the teeth, but you're not really doing the teeth itself any justice.
Okay.
If I were to take the teeth apart, you have to remember teeth have surfaces that touch, these touching surfaces.
Yes.
Okay? So on these touching surfaces, if you're not actually rubbing them clean, plaque is still on it. The bacteria in our mouth have evolved in a way where they stick to surfaces. It's not like Teflon where the bacteria just slide off. They learn to develop and stick onto your teeth. So in order for you to really floss, 1 second, let me just put this model together.
No problem.
In order for you to properly floss, you got to get the floss inside.
Mm-hmm.
space, and you got to do a wraparound, like a little C wraparound. Like
oh.
And then from there, you have to go up and down a few times.
On both
while
sides?
you're wrapping around the tooth.
Yeah.
See that?
Yeah.
While you're wrapping around the tooth, you gotta curl it and really go work at it like a little C. And then you want to work onto the next tooth adjacent to it. And you want to do the little
other
C
side.
wraparound. Yep.
Yeah.
And you want to wrap around like that again.
Mm-hmm.
Okay. And now you want to rub it up and down as well.
Yes.
So you really have to get some, elbow grease in between your teeth to really, floss and remove the plaque. And patients would sometimes ask me, when should we do the floss? Should it be after or before the brushing? It really doesn't matter. You're going to rinse anyway after.
Right.
And whatever the bacteria that you flossed off, they're kind of free floating and they'll just be rinsed away.
Okay.
But as soon as you finish brushing your teeth, mouth rinsing your mouth, the bacteria are all coming back in 30 seconds, right? So it's an ongoing battle between you and these bacteria in your mouth.
Right.
And for the most part, the mouth is a very crowded place. There's over 500 species of bacteria in there. For the most part, they're very happy communities, kind of like us. We get along pretty well.
Yeah.
But you do have 1 or 2 or 3 kind of bacteria that do damage.
Yeah.
You got one that causes cavities. You got ones that causes gum disease and bone disease.
Yeah.
And so those are the main culprits of what we're trying to attack.
Yeah.
By removing all the food, the plaque, you're basically starving the bacteria out. They don't have any more food to eat, go from. So they cause no damage.
Right? The bacteria lives on the food that's stuck in your teeth.
They will actually live in the plaque. The bacteria is an accumulation of plaque. So if you were after a long day, if this is nasty, you take your fingernail and you scrape your teeth, you get that yellowish, whitish stuff.
Yeah.
The more yellow it is, the worse it is. It better not be dark yellow. But if it's a light yellow, it's very fresh bacteria that accumulated through the day.
Okay.
And if you were to look at under that in a microscope, you'll see there's thousands and hundreds and thousands of them in there. Yeah. But you have to make sure. So that's what you need to remove. You got to remove the plaque, which is the food source.
Okay.
No food, there's no buffet in your mouth.
Right.
The bacteria don't get to eat. They stay premature. And as long as you stay on top of it, they stay like that.
Now, the dark yellow to the black that you mentioned, is that if you look in your teeth, are you going to see that actual color, like in between?
No. So plaque won't turn black. It'll just turn like a lightish, whitish, pale white, ivory, I guess you could say white, into maybe a darker yellow, depending on how long it's been there. Okay. Really long-term plaque that's been there sometimes can look oranges too, at least from what I've seen in my patients' mouths. But that's when I know that they're not doing enough good hygiene, right? A lot of times people are like, oh, my dentist doesn't realize I'm not brushing and flossing. I'm getting away with it with these awesome routines. Absolutely. Most dentists know. They just probably don't want to chat with you because they don't want to spend, 20 minutes telling you that you're not doing a good job. But at that point, it's like, if your gums bleed, that's a really good sign that you have gingivitis. Yeah. I wanted us to talk about that because you were mentioning when you floss, and the floss, I think a lot of people would say, when I floss and I try to floss, my gums bleed a lot. What would you, so you can continue to talk about it. So you were saying that that's gingivitis. Yes. So gingivitis is the inflammation of your gums. Okay. And that's when your gums are red and angry. You poke them, you blow air on them, they start bleeding, right? Oh, wow. Yeah. Just like and like you said, you're right. A lot of patients who start flossing, they realize, wow, I'm bleeding so much, they stop. They think they're doing more harm. Yeah. Well, in reality, the gums are bleeding because it's trying to get your attention. Okay. I tell this to my patient all the time. If your hands just started randomly bleeding, wouldn't you go see a doctor about it? Absolutely. Why is it any different that if your gums are bleeding, you don't? I don't know. But like you said, I think it might have to do with the education and the knowledge of dentistry. Yeah. You shouldn't be bleeding. If they're bleeding, something's going on. And you need to see a dentist for them to tell you whether this is normal because you have some kind of filling or crown that agitates the gum, or is it something that's actively causing harm to you? Yeah. Right? So the gums are your number one your line of defense. If your gums go, your bone's gonna go. Yeah. So that's the importance of why we gotta keep our gums healthy, because we need to keep our bone healthy. Yeah. So in that sense, what we have to be doing is, once again, brushing and flossing properly, and that's the only way for you to make sure you keep the issues away. Absolutely. Thank you so much for that. Yeah. Now,
I wanted to talk a little bit about cavities because I know that a lot of people will have it. That's kind of like one of the number one reasons why people do come to the dentist. You know, sensitive skins, would you say, or cavities, or maybe you're the dentist, you're the professional. So what would you say are the number one reason why people will come to see you?
Well, lately, due to the pandemic, number one reason has become fracturing of the back teeth from clenching and flossing.
Anxiety.
It seems like people are getting a lot of, I guess, pandemic stress or anxieties,
Yes.
and they're not realizing that they're waking up in the morning with a sore joint here. You know, if you push here and it's sore in the morning, it means you're probably clenching all night or you're doing something. So right now, we've gotten a lot of great broken teeth, a lot of sensitivity issues, just from the clenching and bruxing.
So the broken teeth is from the clenching too much.
Yes, clenching way too much. Because on average, this is probably like another Snapple fact that you like to know, but a lot of time when we're just at rest, our teeth are not touching.
Right.
Okay, our teeth are actually slightly at rest. We're slightly apart. You know, the teeth are slightly like a little bit open when you're at rest.
Okay.
Once you start thinking about it, you're gonna put your teeth together, so it doesn't work like that.
Yeah.
But for the most part, it's usually at rest. The thing is that they're not meant to be touching and clenching and grinding unless there's food there, right? Because then there's going to be wear and tear and breaking and cracking of the teeth. And most of the time that ends up becoming crown work. But before that, we were getting a decent number of people just coming in for simple fillings here and there. It really comes down to like how your patients are maintaining things. And at that point, we can talk about cavities, right? Like you have to make sure that if the cavities are starting to form and they're really small, they may just look like a little black spot in your tooth.
Okay.
Right? But that can eventually start.
That's a big spot, Dr. Benny. That's not little.
That's a big spot. Usually in the mouth, it can. Well, you'd be surprised. There's some people who walk around with bigger spots than this.
Wow.
And they're like, okay. But usually you could think of it like just maybe a speck or something. You know, like lines drawn in. Let me see if I have something that's a little bit. No, I don't. Well, these are just basically full-blown cavities. But some of those dark spots in your teeth, those lines, if they're thin lines, they're most likely staining. But if you're starting to see circles and stuff or shadows underneath teeth, because teeth should be nice and white. If they start to turn gray or colors, something might be going on, right?
Yeah.
But to minimize cavities, you want to really limit your frequency of snacks and meals through the day. They have found that people throughout the day.
Oh, okay.
So every time you eat, food going into your mouth, and the pH level of your mouth goes down. It's acidic from the food. And when that happens, that's when the bacteria goes to town, because they won't like that acidic environment. And you have to make sure that at that point you're not letting that happen. So it's frequency of meals. So let's just say you have breakfast, lunch, dinner. Yes. And you're like a little hobbit, and you're putting in like after a second breakfast, a second lunch, a second dinner.
That's a little bit much.
That's a lot. At that point, the bacteria has constant access to food. And I doubt you're brushing and flossing after every meal.
Yeah.
So the frequency, so that means your pH in your mouth never, ever neutralizes. It's always in this like free food, let's go to town day, right? So we got to limit those. And it's just frequency. It's not even about snacks. We're talking about frequency of anything. Yeah. All right. Wow. And obviously, when you want to talking about food, you want to limit sugar, right? Carbs.
It's kind of hard because it's found in like almost anything these days.
Exactly. So that's why it's even more important that at the end of the day, you brush and floss. So you don't have to limit what you eat. Yeah. You can eat whatever you want, and as long as you eat, brush and floss, it's okay. But it's the problem. It adds in when people don't brush and floss in the day.
Now I know. Yeah. Sorry about that. Go ahead.
Go ahead.
Now I know. I want to ask your opinion on this because it's something that I don't do it frequently, but I did do it. Like I'm a coffee drinker, right? So whenever I go to the office, I'm working from home now, but whenever I go to the office, I don't always like to chew a gum or something like that, or So what I do is to make myself feel comfortable, I bring a toothbrush and toothpaste. Do you think, I also know that over brushing can be problematic as well, right? Or no?
I don't think over brushing can be problematic. It's the timing of when you brush.
Ah, okay.
So after a meal, you don't want to brush right away. Right? What was I was just mentioning, like your mouth is a little acidic. You know, there's a breakdown of some of the minerals at a microscopic level. And at that point, by you brushing, you're just kind of like you're going at the teeth when it's at its weakest time.
Oh, okay. Wow.
It's always best to wait 30 minutes after a meal. That's when the acidity in your mouth starts going more neutral, and then you can go and brush and floss and do what you need to do, and it should be okay. And a good thing you brought that up, because there's also a lot of people who feel like if they brush too hard, they're gonna lose bone and gums, and that is true to some extent. If you're, let's say, very aggressive and your bristles are super duper stiff, and you're going to town where you're bruising up the gums and the bone, that can happen. But in reality, now these soft bristles that we have here, you're not. And that's why when I tell people to angle into the gums, some of them be like, are you sure I'm not going to get gum recession? I'm like, no, you're not. By you not brushing properly in those spots, you will definitely get gum recession. So that's another thing that I want to make sure we remind your viewers.
Okay.
Right?
You mentioned soft brushes, and I will tell you that I always thought that at least if it's a medium level of, I'm going to say coarseness, because I don't know the other word to use, that, you know, there's a very, very soft brush.
Yeah.
You have the one that's like, oh my gosh, it's going to break your teeth. But then an easy medium, like they're making some now that's kind of like, it's rubbery like some of the toothbrush now is kind of like Oral-B or whatever that it's like it's different than some of the things that other toothbrushes are made with.
Are you talking about the rubbery ones on the side?
Yeah.
Gotcha. Those are the gum care ones, right? Supposed to massage your gums.
Yes.
Yeah.
So I want to know what's the best kind of toothbrush, because I have the rubbery ones and I have the softer ones, but I always say the softer ones are not really doing the job. Is that really?
Why do you say that? Why do you say that?
Because it's like, it's soft. It just goes shroop, shroop. I don't like, you know, when you have to, I feel like you have to get between. And I was like, but this isn't really doing it. Like, I was like, you know what I think? It takes off like the plaque on the top. Like when you wake up in the morning, you know, that thing that you said after you eat or whatever. To me, it takes that off. But maybe it's the way I'm thinking about it. Maybe that's what floss is for.
It is. And, you know, like, you're not the only one that thinks that, you know, going harder is better with the bristle heads. A lot of people think that's the best way to go. And this is what one of my attendings back in dental school told me. It is a marketing scheme.
Wow.
They don't come after me now. Revealing the dark secrets of the industry. It's a marketing scheme, you know, like at that point, they're like, yo, there's gonna be people out there who don't realize, that don't know better, and they're gonna think harder is better.
That's the thing.
At that point, when I just make a harder bristle head to cater to those people, they're not gonna, it's not like they're gonna call us and be like, yo, your toothbrush is too hard.
Right.
So that's why you have those hard bristles out there. And I honestly don't think anyone ever needs a hard bristle. I think most of the dentists that you're gonna encounter are gonna tell you the hard bristles are overkill. Medium to soft is all you need.
Okay.
And a lot of people think, oh, if it's hard, I'm going to scrub things off. I'm like, yo, if you're scrubbing your enamel off with a toothbrush, you got other problems. You got other problems going on. That means you got either loss of minerals, you got maybe cavities going on, but good, natural, strong teeth should be able to take a good brush, a normal brush. So that's the number one thing that people have to realize, like the bristle head, the strength, the hardness of it does make a difference, because if it's too hard, it can cause damage over time if you're brushing too hard. And those are probably the people with the heavier hands anyway. So to answer your question even better, electric toothbrushes are the best.
No way.
Studies have shown that's 30 times better. And like I said, I think maybe I mentioned it to me, but I haven't. But if I put you in a room with an electric toothbrush for 2 minutes and put you in a room with your manual, whatever preference you want, medium, soft, bristle, toothbrush, your electric self will always beat your manual self. You're looking for that squeaky clean porcelain sound, right? You ever do some dishes and, you know, after you're drying it goes squeak, squeak, squeak.
I like the dishwasher.
Your teeth should squeak, squeak, squeak too after a good brush.
Would you say that the electric toothbrush would cause you to need floss less?
No. It does not replace the floss. Nothing will ever replace the floss. Everybody wants something to replace the floss, where it's like a 2-for-1. There's no such thing as like a 2-for-1 thing in dentistry,
It would be
right?
great if you can invent it, because that would work. That I'm pretty sure
Uh,
I'm your first customer. That would be
yeah,
great.
if I could invent something like that, I think I might not even be a dentist anymore.
That is true. That is true.
Like everybody buying it.
Yeah, that is so true.
But unfortunately, there isn't. And unless we somehow know how to, a product that can get in between the teeth. Oh, actually, I think they've been making a water pick and an electric toothbrush all in one. I don't know how that's going to go, but I think I might have seen that product starting to come out.
Oh, really?
So maybe that's supposed to do something, but I can imagine how the counter space will take, and also the water mess as you're brushing, just like power washing your face. I haven't tried it myself yet, so I won't chime in on it yet. But I think I have seen a company starting to do that, and we'll see what happens then. But oh yes, remember the a little bit the whole thing about like people's gums bleeding?
Yes.
Yes, you have to floss for 2 weeks straight.
Okay.
Like, some kind of in-between thing, whether it's a water pick, a floss,
Yeah.
those little slingshot things that people like to use a lot, right?
I don't like it.
Any kind of physical cleaning in between 2 weeks straight, and I promise you, your gums will start bleeding less.
Yeah.
They'll get sensitive. They'll change color as well. Like they'll go from a dark, angry red to a more coral pink color.
Okay.
And just like how when we lift weights and stuff, we get calluses.
Yes.
Your gums will start maturing and start getting keratinized.
Yeah.
They'll get beefy, and they'll be able to take a good cleaning. And that's when people can finally come to the dental office and get a cleaning and be like, wow, that didn't hurt.
Right.
Because if your gums are hurting and throbbing after dental cleaning, it probably means you're not taking good care of them enough.
Okay.
Or the dentist got a heavy hand, one or the other. Yeah.
Irritating the gums, yeah.
Yeah, but I just want to make sure people realize this. It takes about 2 weeks for that bleeding to come down. And as long as you're seeing the bleeding get less and less on a weekly basis, you're doing the right thing for yourself. And remember, flossing should never hurt. If you're putting the foot down and you're pushing too hard, it's going to hurt. And do not do the seesaw technique where people put the floss in and they'll pull in and out. Yeah. Don't do that. That's how you cut your gums. You want to go up and down, okay? Up and down the tooth. Yeah, so we'll cover that. At least that. I just remembered that. I was like, I got to tell them about that.
Awesome. Thank you for that. So if anyone is experiencing bleedy gums, definitely floss 2 weeks straight every day after each meal preferred, I guess, and you will definitely begin to see results, right?
Correct.
Awesome.
I think you brought up something about sensitivities, right?
Yes, that is exactly what I want. Because a lot of people, I would say, I have experienced sensitivity some years ago, and it's very, very uncomfortable.
Do you mind me asking what triggered your sensitivities in the past?
It probably was around like when I was pregnant at some point.
Okay.
That's probably what I can't fully pinpoint exactly what happened. All I remember is that like if I were to drink anything hot, or anything really cold, the gum would be like, fighting.
Oh, it's the gums, your gums, right?
Or the teeth. I don't know what the mouth would be sensitive. I don't know.
Well, it's a good thing that you brought that up in terms of, you were pregnant at the time, because let's just quickly talk about that real quick. Any pregnant ladies out there, make sure you see your dentist before you start going into your and if you can see them before you get, in your first trimester, do it, right? If you need any major cleaning or anything, that's the time to get things done. Is to make sure that your dentist is aware, because you don't want to having a dental infection or a dental issue during the crucial points of your pregnancy, right? Mm-hmm. Like we don't want to be doing work on you when you're in your third trimester. We don't want to be causing stress to you and your baby. Mm-hmm. So it's one of those things that make sure you see your dentist early on. And it is normal to have gums that get a little bit more swollen, bleed a little bit more because of the hormones. Yes. Right.
Bleedy gums, definitely with pregnancy. Yeah. Absolutely, yeah.
And sometimes the gums will get a little bit inflamed. Mm-hmm. They'll swell up just because of the hormones. And so if that happens, make sure you reach out to your dentist and let them know, and they'll tell you ways to help manage that.
Okay.
But yeah, like during those times for sensitivities from non-pregnant people, mm-hmm. It has to go down to what you're sensitive to. What's triggering it? Is it sweets? Is it something like cold? Is it something hot? Because all that would help the dentist determine what's going on, the diagnosis for your mouth.
Mhm.
Because if it's something cold and, something cold like ice cream, that's probably normal. Your teeth are gonna be sensitive to cold. That's the normal response, and a lot of people don't realize that either.
Mhm.
It should go away after you take the cold stuff away.
Mhm.
But if it's lingering around for minutes, that's when something else is going on, and that's not normal.
Okay.
That means you might have a cavity going on, and at that point, the dentist will help you out on that too.
I think that's
Um,
what happened to me. Yeah.
yeah. Then let's just say hot sensitivity. If you're sensitive to hot things, you might have something else going on. Maybe a tooth needs a root canal somewhere. I don't know. But if it's met with a throbbing, pulsating pain in your head, and the cold and the hot makes it worse, then there might be something going on there. It's hard to say, but for the most part, most people don't really complain about hot too much, right?
Yeah,
It's
it's
not
really cold.
but it's mostly cold, which is a normal thing as long as it's a few seconds and it doesn't linger. And when it comes to sweets, hey, if you're having pain on sweets, there's a cavity somewhere, and that's another reason for why you should see a dentist. I know people who are very sensitive, like to use Sensodyne, and they don't never graduate from Sensodyne. They'll constantly use it.
Wow.
That's not normal. I tell my patients all the time, if you're using Sensodyne for more than just 2 weeks, there might be some other things going on, and you should just make sure you inform your dentist so they could make sure that it's not because you're losing the first layer of your tooth that's exposing the second, which is now making it more sensitive.
Sensitive, right.
Or at that point, you really want to make sure that you're not covering up the sensitivity with a toothpaste or the issues with that.
Yeah.
You bring it to attention, because once things are healthy again, you should be able to go back on a normal fluoride toothpaste.
Yes. Awesome.
Right?
Okay. Guys, if you're still here with us, please don't forget to like, share, and subscribe. We are here today talking with Dr. Benny, the dentist, and we're talking about all things oral health, okay? So, Dr. Benny, you mentioned earlier that when you were 15, a dentist actually inspired you, right?
Well, I wouldn't say inspired, but he definitely made an impact on my oral hygiene, right? Because I didn't go into college like, yo, I'm gonna be a dentist.
No, I know, but he still made an impact, right?
Yes, he did. He's made me realize, like, wow, we gotta really push that agenda of preventive and oral hygiene across, and that definitely I agree with him. Because once I became a dentist, I realized, wow, he was a really good dentist, right? Like 15, you don't realize he's a good dentist,
right? Of course, you're not thinking
you're telling me to floss, he's yelling at me to floss and brush, and you're just like, okay. And you don't realize, but then when you finally at this age now, yes, this definitely a positive impact on my life. And to be honest, I wish I remember where he is now, because I would love to say, hey, thanks.
Right.
But in terms of what made me go into dentistry was, I just love sculpting things. I like restoring things to their normal glory if I can. We'll never get close to Mother Nature, but we can strive for excellence when it comes to fixing teeth, at least,
Absolutely.
So that's the fun part of it. And I like to try to give people a different experience with the dental. It doesn't have to always be scary. Like you said, nobody likes a dentist. I don't like to see my dentist either. I'm scared of venues as well. I'm like everybody else. But we could do things to minimize that risk factor and to really hopefully make your experience a little bit better, right? But yeah, I'm sorry, go on with the question then,
No problem. That's okay. It's good to share your story and your experiences as well. So I know that I brought up the 15-year-old situation because I wanted us to talk about a good age to start flossing for kids, right? And
as soon as you get first molars.
The molars are the ones in the back, right?
Yeah. So as soon as the little kids. So luckily I have the kid's mouth here with us. As long as the big guy of the kids come out, you pull that one out, and it's usually at 6 years old. It's a molar tooth that comes in, right? This big molar guy comes in.
Yeah.
When that guy comes in, or as soon as there's contact between teeth.
Okay.
Start introducing the floss to them.
Okay.
Right? And that's the parents' role at that point. A lot of kids need help from their parents until they're 6. Right? They don't develop the hand dexterity skills to really get all the nooks and crannies too well. So I think most parents need to really oversee their kids, and that doesn't happen enough.
Okay.
All right. I think parents let their kids off, go brush and floss, go brush on their own, and kids don't actually get introduced to the floss until much later in life. I want parents to start introducing it early in life, because that way they start utilizing it.
Yeah.
So even if they don't have the spaces in the beginning, if your kid is enthusiastic to floss, just throw them in floss, even if they're not doing anything with it.
Right.
Just get them used to it.
Around.
Yeah, with their mouth with the floss, just give it to them.
Okay.
Because eventually they will do the right thing with the floss and and floss their teeth once things are starting to touch.
Yeah.
But for the most part, I think as soon as the 6-year-old and the molars are coming out and they're touching teeth, you should start flossing them immediately because nothing's going to get in between. All right. Okay. And we're just trying to, just like how we're taught to wash our face when we wake up in the morning, yes. Hopefully the habit develops. But the habit's the hardest thing to develop when it comes to flossing. It's actually not the technique. You know, mm-hmm. Everybody who sits there long enough with a piece of floss will learn to floss.
Yes. Yes. Mm-hmm. Thank you so much. Now, I know I want to talk about something that I experienced when I met you in the office. And I don't know your assistant's name. I'm really sorry.
Nina.
Elena?
Nina,
yes. Hi, Nina. But I wanted to talk about something because I know I mentioned it in the beginning, that the way you and Nina worked with me is why I kept coming back, right? I had 2 visits because I had to do one side and then the bottom differently. But the way in which you guys treat your patients, right? It's like, first of all, the fact that you are beyond the dentistry in the sense where, I guess it wouldn't really be beyond the dentistry, but you like to educate. It's not just, oh, you're here for an appointment, come, let's do what we got to do, and then you go. Right. Every step of the way since I entered, you have been educating and still are educating. And you just don't find that a lot. And I just wanted to say, and maybe you can share on that as well, and how important that is for others who are developing better oral hygiene. Because one of the things is you also was able to set the atmosphere, right? Because I had to get numb. My gums had to be numb because, you know, it's a deep cleaning. And without the what is the name of the medication or what you gave? The numbing agent, what is that called?
The lidocaine.
That word. I wouldn't be able to bear it, right? Because, you know, it's just painful. But being able to relax and, you know, you're asking me like, what do you like? You know, what kind of music do you like? Are you comfortable every step of the way? Are you comfortable? Just continuously checking in, making sure that I was fine. And I was able to say, tap out, like, okay, I'm feeling that, or thumbs up or thumbs down. Having that constant communication, you know, it's like you're treating the whole patient, you know, you're making sure mentally I'm okay, you know, all of that stuff. And I want to commend you guys because, and it's the same thing with my daughters when they go to Dr. Glen, like they are completely comfortable. And, I just want to tell you guys, like, seriously, thank you, because it is very much important and it's not always seen. I know in the medical term, you know, they call it bedside manners. I don't know if it's the same thing for dentists.
Same thing.
It's the same thing. But you guys exceeded expectations. And I just want to say thank you to you and Nina. And I want you to touch a little bit just on how important that is, you know, when you're working with individuals.
Yeah, well, first, thank you so much for noticing. I think sometimes just hearing it is a nice thing. It continues to validate that what we're doing here is it's going towards a positive impact on people. Absolutely. So the fact that you're able to pretty much hit the, you know, those are exactly what I wanted to do, is make sure my patients are comfortable, make sure we communicate, make sure my patients realize that you guys have complete control. My number one priority is to make sure you're comfortable, and then the dentistry comes second. The dentistry is pretty easy for us once, after so many years of practicing, it becomes pretty second nature. But I think it's always comes down to managing every patient is they're always going to be different. You can never master managing people, right? It's just too many different people out there, personalities and everything, expectations. So at that point, the open communication is probably the key to our success here. If it wasn't for that, we'll just be like any other office. We make sure we take the time to talk to our patients here, get to know you guys. Because like you said, we're not just treating the mouth, we're treating the whole body at that point, full health. So thank you so much for noticing that. And I'll let Nina know too, because I'm sure she'll be very happy to hear that too. You know, like, she's like my right-hand girl, and without her, I wouldn't be able to give her.
She's doing amazing.
Yeah.
Yeah.
So it is, at that point, it's to try to establish a relationship with our patients here, right? We're trying to figure out what your expectations are. What are you here for? Is it, you know, and how I can get you there.
You're building that rapport, right?
And like, we're trying to really meet your needs, not just you come in and someone just telling you what you need, and just expect you to go off and just do it. You know, I really need to help guide everyone along, because before dental school, I didn't know anything either. So it's like, if they're teaching me all this, how do I expect anyone else to know all this? It's for me, it's like 4 years of schooling to learn this stuff. It's like, I expect to squeeze all that into a 20-minute appointment, right? So I try to break it down in a way where people can understand me. And the communication also helps with a lot of anxiety patients. I think people who are like high anxiety want to know that they're in control and that they can tap out if they can't, if they're not able to at that point. And I like to work with those kind of patients and just take it at their pace. It's not my pace, it's their pace at that point. Because if it's my pace, oh man, we're going to be not rushing, but finishing things on a quick, in a much more efficient manner. But if there's anxiety to be managing, I probably slow it down a little bit, because at that point we want to build the confidence, and we want to build confidence in the patient for them to finally come into the office. Right? For the anxiety patient, just coming to the office is an obstacle. So we want to be able to just give them an easy time to realize like, it's not that bad, you know, we'll ease them in. When technically that should have been done when they're younger. And that's why as soon as you have a baby that kind of little tooth that comes out, bring them to the dentist. Let them hear these weird noises, the weird smell, the weird people in the mask. Let them see these things, so that way it becomes more of a normal thing. Try to normalize it for these little ones. And that's what we're trying to do for people with high anxiety. We're trying to normalize these visits and make it more comfortable and manageable for them. So that way when they come in, they're not taking a Xanax or something beforehand. Right? We're getting a sober version of them as a
wow.
Yeah. So it makes me happy when patients tell me, hey, I don't have to take a Xanax anymore. Like, wow, that's awesome.
Wow. They have really, really bad anxiety. Wow.
Yeah. So for me, it's just like the open communication is also going to make sure that I understand your expectations. So if I can't meet you there, I'm going to let you know. But the thing is, like, I know enough other colleagues who probably can, if it's beyond my experience level. So for me, even me, it's like about the knowledge. And that's why I also teach at the hospital. It keeps on top of things. And sometimes my residents are teaching me things, right? They're telling me, hey, doc, did you see this new product that's out? And I'll go do my research on that, because I'm like, no, I never heard of that. You know, there's like new generation stuff. So it's one of those things that it's, you know, the teaching at the hospital is always a very humbling experience too, because of that. But yeah, like teaching the patients is very important as well. And like I said, open communication, making sure you guys are comfortable. Yeah, so I don't know what else at that point say. Hey, I'm glad we're striving, you know, doing good deeds here and doing a good job with our patients, and hopefully we can continue to improve on it based on your feedbacks.
Definitely. Dr. Glen's Happy Teeth and the whole practice I enjoy, even when I go in and I get welcomed and all of those things. I have a good experience there. So I would definitely recommend, if you live in Long Beach or any areas surrounding there. I don't live in Long Beach, but I'm not too far. But definitely check out Dr. Glen's Happy Teeth. You will enjoy your experience there. So
do you mind if I just bring up the topic of mouth rinses? Because I think that was a common question that people always ask me.
Please do, go ahead. Yes.
Yeah, so a lot of people always ask us if they can just use mouth rinse and that's it. You know, the answer is gonna be no, right? Because if there was a magic,
without the flossing,
it cannot replace flossing or brushing.
Okay.
And some people think, oh, these mouth rinses are being advertised as killing the bacteria.
Yes, that is true. They are advertised like that.
And yeah, they may kill the free-floating ones, but the ones that are stuck on your teeth, they're not doing anything. You need to get a physical floss or brush in there to remove the plaque. And then you can do your mouth rinse after if you like, or before if you like. Some dentists will recommend you don't do the mouth rinse after because you rinse away the fluoride from toothpaste. For me, whatever makes you do your hygiene more.
Okay.
You know, if mouth rinse is going to make you remember to brush and floss, then do the mouth rinse.
Absolutely.
Otherwise, you're just going to be using mouth rinses for like garlic breath or bad breath, right? But please do not replace your brush and your floss with a mouth rinse. You want to supplement your brushing and flossing with a mouth rinse. Okay.
Do both.
Or just do all of them, or just do, you know, the flossing and brushing. Right. But the mouth rinse isn't always a necessity. There's not enough studies to even prove that it does a big impact from there. I guess unless you have the fluoride mouth rinses. You know, it helps supplement the fluoride toothpaste a little bit.
Okay, that's a very good point. I actually wanted to ask, but I forgot about that one, the mouth rings part. Definitely, thank you for bringing that up for sure. Okay, so Dr. Glenn, I just want you to close us off with just 3 things that you can, based on what we've discussed, that you would like our viewers to remember about keeping good health, good mental hygiene. 3 things.
Good mental hygiene or good hygiene?
Oral hygiene.
Oral hygiene, got
Yeah.
it. You got to brush twice a day, once in the morning, once at night. That night one is really important though. You don't want to be going to bed with food in your mouth because your saliva goes down, right? You wake up in the morning, your mouth is a little dry. The saliva is the buffer, as I mentioned earlier today. So if you don't have the saliva, there's more damage when you're sleeping and you don't do your, flossing and brushing. So make sure you brush once in the morning and once at night, okay? And floss before you go to bed. Some people like to floss in the morning. Bring it to the night. You're not eating at night when you're sleepwalking and eating. So you got to make sure you're flossing right before you go to bed. All right, that's going to remove all the food in between. And make sure you guys understand the techniques, the angles of the toothbrush, techniques of the floss. Yeah, like those are going to be key components to your hygiene. And make sure you're using products that have an ADA approval on it. That means the American Dental Association has already done their studies on it, has already recommended on it, and it's pretty safe to use at that point. So if you're ever in doubt, look for the ADA seal of approval, okay? I think that's about it. It's quite easy to do good hygiene. It's just a habit that people need to be doing because it takes anywhere from 2 to 3 minutes sometimes in a day to perform the proper hygiene.
Yes.
And it's just taking the time in the day to do it. It's building up a habit. And early on, it might be the best to just start maybe flossing 4 to 5 times a week, or every other day in the beginning.
To get into the habit of doing it.
Correct. It would be better if you just do it every day. But the thing is that sometimes some people set up a goal that's not realistic, which is like every day, like me in the gym. You disappoint yourself a little bit, right? Don't show up.
Need to go.
So I tell patients, don't set yourself up to fail. Set yourself up for something realistic.
Manageable goals, right? Attainable.
And I think usually when patients start flossing, they see the food come out.
Yeah.
And that starts actually implementing and pushing them the reinforcement that they need to continue. They're like, holy cow, there's so much food coming out of this.
Yeah.
And next thing you know, it's like they're flossing nonstop, right?
Absolutely.
So that's the same concept there too.
I know you're busy at work, but thank you so much, Dr. Benny. I really appreciate you being here to share your thoughts, your wisdom, and your expertise on maintaining our oral hygiene, oral health, and to basically help our teeth get better. Yes, go ahead.
Well, thanks for having me. It's a pleasure being here with you. And if we could get even one person to change their hygiene from this, that's all that matters, right? At this point.
Yes, absolutely. That would be fantastic. Well, thank you again so much. And thank you guys for watching. If you're here till the end, oh my gosh, I hope you are going to really start to implement all this knowledge that you just gained and witnessed about brushing your teeth and flossing, and so that you can develop better oral health. Thank you guys for joining us here again at Underneath Her Skin. And I hope that you would like, share, and subscribe to this channel where we talk about things that we're sometimes afraid to talk about or to disclose, the things that we don't like to share often. So thank you guys for watching, and we will see you in the next video. Bye-bye.